alert for men. New findings show that if you get your prostate exam annually, you get a false positive reading on that important blood test. Well, CBS 12's Lena Salzbank sat down with a urologist who says the COVID-19 vaccine could be the reason to blame.
Dr. Diego Rabinowitz is asking all of his patients to keep track of when they received the COVID-19 vaccine after linking the shot to elevated PSA levels.
I have seen patients' PSA to be falsely elevated for at least 6 weeks after getting the vaccines.
PSA levels are looked at with a basic blood test, and elevated levels are typically found in men with prostate cancer. But PSA can be falsely elevated due to a number of conditions.
Other things that can cause the elevation or an increase in the PSA are, for example, a urinary tract infection or a vigorous exercise and any other condition or illness.
New anecdotal findings show that men who get the vaccine and then have their PSA levels also show a spike.
I was seeing patients that were coming in with a history of having a stable PSA, and all of a sudden the PSA had risen.
The urologist looked back to see if any other patients had similar issues and soon connected the dots.
Sure enough, I've had a few patients that have had the vaccine shortly before the PSA.
Dr. Rabinowitz says that his patients were initially alarmed, but after retesting weeks later, his patients' PSA levels normalized. These are the results of a patient who will remain anonymous. As you can see, the person's PSA levels remain stable at 0.4, but a month later after taking that vaccine, that person's levels raised 9 times to 3.4.